I'm Dr. Barry, licensed psychologist, and here I share legal and entertainment news from a psychological perspective. Today, we're doing something totally different. This is for parents, teachers, anyone that helps children. I wanted to explain some parts of the mental health system because it can be very difficult for parents to navigate this on their own. I'm a psychologist, and even when I try to find resources for my own child, it can be very difficult. I am based in Virginia, so a lot of the things that I say will be based on Virginia. And this is going to be sent out to a Prince William County elementary school. And that particular county in Virginia has a special program where students can get free telehealth therapy. And so that this portion of that will be specific for Prince William County. All right. If people, because I am live, I thought about recording this and releasing it later, but if there are general questions, feel free to put them in the chat. I'm going to be doing this on a quarterly basis, talking about different mental health topics. I think one of the big things that it's important for parents to realize is that a child's behavior is often communication. Kids will show us that they're not okay before they tell us. And that's not to excuse behavior, that's not to excuse anything. It just kind of helps me understand and it changes the framework that I have when looking at a child's behavior. As a parent, I have to identify the types of things that are very triggering for me as a parent. And because when my child does the thing that really triggers me, I might have a different reaction. And as a parent, I always want to be bigger, stronger. Like I want to model what I want my child to do. So if I want my child to, you know, learn how to manage his emotions, if I want my child to do those things, I have to model that. And as a parent, I'm not gonna get it perfect. Just this morning, I was walking with my child to school, and we crossed a street, and he did not look. Like, the cars were coming from the right, and he was only looking to the left, and I yelled out for him to, of course, like, I'm a good parent, I yelled out for him to stop because there were cars coming, and so once we got safely across the street, I told him, I was like, you're safe," because I could tell he was kind of frazzled because I normally don't yell. I'm not a yeller because yelling at a child, it puts them in survival mode, and what I mean by that is when a person is being yelled at, their immediate response is to defend themselves, is to go into self-protection, and when people are yelling, it shuts down their thinking brain. So, but in that moment, I needed my child to go into survival and stop. Like I needed him to stop. And that's exactly what he did. Everything was safe. We were able to make it safely across. But I don't want to always parent from the perspective of yelling. I don't want to desensitize my child to yelling. And there are people that have certain situations where their child where because I have parents tell me they only listen when I yell. And that's where partnering with a therapist that can kind of help navigate some of that. Because sometimes there are other deeper things going on. Sometimes there are undiagnosed executive function issues. Sometimes there is an undiagnosed hearing concern, like where the child literally, like their ears are full of fluid and they can't hear except when it's above a certain level. And so making sure that you're navigating these things with your doctor, with your whole team. So I like to take a whole perspective because when a child comes with mental health concerns, if they're not sleeping well, if they're not eating well, if they are being bullied at school, those are things that are going to have an impact on their mental health, and talk therapy isn't necessarily gonna be what's best for that. And so, yay. And so, like I said, like as just as a person that supports kiddos, I like being able to share this. Welcome, welcome, Mama Bear. And so and I think I've done other videos on caregiving. Um, and that is a thing. All right. And I also wanted to stress the importance of parent mental health. So I have been practicing as a psychologist licensed in Virginia since 2010. And I got into this because I wanted to help kids. I did my internship at Virginia Treatment Center for Children, which it's a short-term stabilization hospital for children. I I always wanted to focus on assessing and treating children. And then 2020 happened, and I immediately learned for myself as a parent and for the kids I was supporting, if the adults aren't okay, I can work with that child for an hour every day, and that child is still gonna have struggles. It's better for me to focus on the adult and help, because if the adult is stressed, and that's where I'm glad that I'm sharing this here, because what I get to share with the clients I work with, and even the grace I give myself is, if I'm stressed out, if I'm having a bad day, I don't wanna take that out on my child. And I don't want my child to think that he's responsible for my emotions. I don't want my child to keep things from me because he thinks I can't take it. And so sometimes as I'm working with a child, what I recommend, I ask the parent, "Hey, do you have someone?" And with my practice, sometimes I have worked with the child and the parent. Sometimes the parent has worked with somebody else. It really is so important that the adults are regulated, but there can be a regulated adult and the child be dysregulated. That can totally happen. And, I have a bunch of books and resources that I'm gonna share at the end, and I'll make sure when I go back later to add some timestamps down at the bottom. So I wanted to talk about the different types of therapy. So when people are looking for therapy for children, there are a bunch of different types of therapy. Some people will have more than one technique. I have a client-centered approach where I have a bunch of tools and resources in my toolbox, and we develop a plan together with the child and the family to see what's going to work best for this child. I am not a registered play therapist. So there are registered play therapists, there are registered art therapists, there are music therapists that get additional certification to be able to say that they are registered play therapists. That's different from a therapist that just has toys in their office, and they might use those as a technique along with other tools in their tool, but that wouldn't be play therapy. To me, play therapy would be done by a registered play therapist because they have that training. I've done some play therapy trainings. I say I do like therapeutic play, so it's not play therapy, but sometimes we use play to see different dynamics. Sometimes different things come out in play that don't come out verbally. I use like art techniques. I have clients working on diamond art right now, and diamond art are these really, like, you have to really focus. So a lot of my clients that struggle with ADHD or with frustration tolerance sometimes will use those tools to kind of build some of that. But the thing, when we talk about different types of therapy, the most important thing is the connection that you have with the therapist. So it doesn't matter if they do what type of therapy they necessarily do. If your child doesn't have a good connection with the therapist, if you don't have a good connection with the therapist, the connection with the therapist is the most important aspect of a therapeutic relationship. Um, and then after that, if my child has been through a lot, let's say we are navigating um, let's say I'm working with divorced parents and the child is struggling with transitions. I want to make sure the therapist is skilled in working with the specific issue that I'm coming with. And so there are different types of services. So there is outpatient therapy, which can be done by a psychologist, by a licensed professional counselor, by a licensed mental health professional. Every state will have different acronyms for what their licensing is. And some states will also have residents. So if my child is just having minor difficulties at school, possibly working with a resident might not be too bad. I've also known some people that have a very complex case, and they worked with a resident who's working towards their licensure. That's what a resident is. It's someone that's graduated with their degree, but they're working towards being licensed and being able to practice on their own. And I mentioned this in another recent video that residents, they always have their supervisor's information available because that resident is actually practicing under their supervisor's license. And that supervisor is responsible for that resident. There are other types of supportive services that don't require a license. So if my child is maybe just having some really minor difficulties and my church has a pastoral care center, then okay, maybe that might be a good fit. But if my child has clinical depression and is engaging in self-harm or having really dark, harmful thoughts, I want to make sure that they're working with a licensed professional because that licensed person is going, and then you want to make sure they have experience in working with clients that present with those types of concerns. So once again, the degree of the therapist, I focus more on license and their training. So like, do they do cognitive behavior therapy? Do they do dialectical behavior? Like what type of therapy they do versus the particular license. So I'm a psychologist and a clinical social worker. We are trained to do therapy in similar ways. So a psychologist doesn't know more about therapy than an LPC or an LMFT, a licensed marriage and family therapist. So, because sometimes I'll get people that are like, "I want to work with a psychologist," and they're thinking that, "Oh, a psychologist is going to know more about therapy." And it's like, no, like I know about, so I might have specific training in diagnosing certain disorders, but as a therapist, I don't diagnose things like bipolar disorder. um, I normally refer them for a psychological evaluation if there is. So I'll have clients that I'm like, I think they might have ADHD. And if we start with doing therapy first, I refer them for testing if I'm not sure on what their exact diagnosis is. So I like clarifying that because there will be people, because it is hard to find a therapist. Like it is so hard. Sometimes people won't call you back. And that's why I like sharing resources. And I will pull one of them up. Um, so I will first search therapist in Fredericksburg, Virginia. So let me share this screen just so I can show you all what it looks like. So if I just type therapist in Virginia, there will be some counseling centers that automatically come up, but Psychology Today is normally going to be one of the first because I think they pay for Google Ads. So Psychology Today is going to be at the top of this list. And what Psychology Today is it is just a directory, but the therapists on here pay to be on here. And Psychology Today does verify the individual's credentials. And so all of these people, because I want to show you all a resident, because on here, so this is a resident in counseling. Whoopsie, I'm gonna go back. Once again, this is what it is in Virginia. Sometimes other states call it something different. On this site, you can filter by your if I want to only search for female therapist or male therapist, I can search for in person, online. I can search for all of these different things. I will tell you on here, for me personally, it's a red flag when the therapist says they do everything. Like that's a bit of a red flag for me. There is a free site, therapyden.com. Let me see if I 22401. And this will sometimes have different people, and with these online directories, you can often sort them by your insurance, and you can check to see if you're looking for any specialized experience, if you're looking for a particular type of service, and sometimes you will get a better response if you email versus if you call. So I run my own practice and I don't have any employees. So I'm the one that calls back. I'm the one that does all the things. And so sometimes so sometimes you might not get a call back. Emails are easier for me to navigate, remember to get back to. And so my preferred way of contact is email and text messaging to schedule. But yes, so if I'm working with a client, so if I am the therapist for so if I start with a client and we're doing outpatient therapy and then they need psychological testing, I come from a perspective that the evaluator shouldn't have a bias. So I don't evaluate my own therapy clients because I might be looking for ADHD and there could be a confirmation bias. So what I do is if my clients need testing, I refer to somebody else and that person does that testing. Sometimes they'll ask me like, "Hey, what are the concerns? Any heads up on any things?" And I'll list what the general concerns are. But if I'm doing therapy with a client, I'm not the one that does the psychological testing. Now, some of my testing clients turn into therapy clients. And so that's where if people are coming in, I ask, "Are you looking for therapy? Are you looking for testing?" Because the way I do it is once I do the therapy, I don't switch it to be the more independent evaluator because just the nature of that therapeutic relationship, it could make me score their questions different. And so I was always trained that as an evaluator that I should be neutral. Now if I lived in a rural area where I was the only psychologist in 75 miles, then that would be different. My area, there are like 4 to 5 that accept insurance, and so it's normally pretty easy for me to refer people out. That's a great question because those are questions that sometimes come up. So for psychological evaluations, so a child can get an educational evaluation at school and but they in most states in the United States, the school psychologist is not going to diagnose. Even if they are licensed as a clinical psychologist, the school, because they don't want to get sued. I think it's all about lawsuits. I think the school doesn't want to cross that medical that their school psychologist is practicing medically. They will just do that portion. Polly, I did save your question. And but Patricia, this is right on topic with what we're talking about. So to me, a diagnosis of bipolar disorder, schizophrenia, um ADHD, if there are concerns about a personality disorder diagnosis, or but I will diagnose PTSD, I will diagnose depression and anxiety for a therapy client, but for some of those other diagnoses, I normally because it can be harder to parse out. some of those things. So I refer them for a psychological evaluation for like schizophrenia, bipolar disorder, ADHD. And in my state, often for an ADHD diagnosis, in order to for the insurance to pay, normally you have to have an evaluation. So as the therapist, often I couldn't do that diet. Like normally the insurance wants or the medical doctor, the psychiatrist, because some of those medications are overdiagnosed and some not medications, some of those diagnoses, they're really making sure that the person meets criteria. So they want some type of evaluation. All right. So I hope that was helpful. Um, alrighty, alrighty. Let's see. Um, and then, so I'm a psychologist. I can do psychological evaluations. Some practices will have what's called a psychometrician. So they will have somebody that's skilled. They sometimes have like a master's in clinical psychology, or they have a doctorate in clinical psychology, but they haven't finished all of they're not a licensed psychologist. So they may do the testing, and then the licensed psychologist reviews the results, reviews the report, reviews the final diagnosis. For me, for my testing, I'm the one that does the testing. I'm the one that writes the report. I'm the one that does everything. But there you will sometimes find that they use residents or interns or students um, and as part of that process. I've been an intern, so when I got my graduate degree, we worked I think it was our second year. I want to say I'm almost positive it was our second year. We worked in our school's clinic, and we did psychological testing. We did all of those things in the clinic under the supervision of our professors and supervisors. And then my internship was my third year when we had offsite, not internship. So I guess those were offsite practicums. We had practicums that were offsite for our third and fourth year. And then I had a fifth year internship where it was a year long. All I was doing was finishing my dissertation and doing and working on my internship as my full-time gig. So um I like to explain those different things because it can be confusing with, okay, like there's an intern. So interns are normally working towards their degree. And this is Virginia. So you can sometimes ask, like if you have a question, you can always ask. The people should be upfront with their education and training. And but I will mention that I had a situation happen where a parent was upset because but I did everything right, and my supervisor, I think for financial reasons, agreed with the parent, and it was what it was. Yes, and it was what but I was following the directions, I was doing the right thing. Welcome, welcome. Teresa, your son's therapist doesn't like calling oppositional defiant as a disorder, but likes to focus on the behavior. So I'm not a fan of the diagnosis oppositional defiant disorder either. I like to, I'm going to look it up. Path and I'm gonna have to do a whole video just on pathological demand avoidance. I don't think I've done that yet. I'm almost positive I have not done a full video on pathological demand avoidance. There is something called low demand parenting, and sometimes PDA can go along with autism or with ADHD. Um, but it's something to research and take a look at if you have a kiddo that engages in power struggles. I also like to rule out that there aren't major transitions. So it's normal for kids to want some level of of control, and as we're modifying that behavior, sometimes you're able to make certain adjustments and changes, and you all hopefully know that, physical discipline can create the same trauma responses as other types of child harm. And I did my dissertation on forgiveness and aggressive children. One of the constructs I researched was corporal punishment, and this was back in 2008, because I defended my dissertation in, I think, 2009, I think. But and the research has continued to show that, when you use physical discipline, it teaches the kid to not make you upset, but that it often makes them sneakier, it often increases issues, and it can create more problems. So, that's just my thing. Um, so I'm not a neurologist, I'm not a neuropsychologist, so I can't, I'm not sure about that question. All right? Um But I can describe, so CPTSD is complex trauma, is complex PTSD, and in the United States, we still don't have that particular, it's not in the DSM-5, but it is something that clinicians use because in my opinion, PTSD describes more of like a one-time incident, or like, but it's not great at describing an individual that's had chronic trauma across possibly a lifespan, or developmental trauma that began in, early childhood, possibly infancy, possibly in utero. And so, those are some of my thoughts on that one. Um, and sometimes what people do when somebody sees an ODD diagnosis, especially a school, they will often minimize, because maybe the child has ADHD as well. So kids with ADHD have difficulty doing things. Like, so ADHD is difficulty completing tasks, difficulty remembering to do things, and an extreme difficulty doing things that you don't want to do and that you don't like. Like, and there are skills, there are tools that you work on to overcome those things. But if a child's ADHD isn't managed, then like, is it really opposite? So I have this thing of, is it can't do or won't do? And let me find those steps too. I did it. Let me see. There's an image that I love, absolutely love. Let me see. Let's share this tab. Let's see how big this is. I'm gonna make myself smaller so y'all can see this better. Nope. Gotta put myself over in the corner. There we go. And I'll make this bigger. So sometimes I see is it that I can't do it? I want to do it, but I don't know how. How do I do it? I can try, like, so that's where sometimes when I see a kid not doing a thing, I have to figure out what's going on, and what's under it. And, is it emotional? Because sometimes there are emotional reasons that people are avoiding tasks. It does not mean that they get away with it. So I'm not saying to let kids get away with not doing their chores, not doing their, no, like, but I wanna figure out, is there something deeper going on? And, it's a whole thing. Are there things going on in my child's life that I'm not aware of, that they're not talking about? Are there issues at school? I work with a lot of kids that mask behaviors at school, so they hold it together at school and then they fall apart at home, or kids that fall apart at school and then, by the end of the day, they're relatively okay. And so, um, all right. Ah, welcome, Patricia. Thank you for watching. Oh, sorry. I don't know. Maybe things are happening in the chat. I'm going to stay focused. All right. So there are different levels of care. And, but I want to go back up to types of services. So for psychiatric medication management, because sometimes people are looking for, their child is diagnosed with ADHD, and they're looking to discuss medical options. So that would be with a medical doctor, not so there are some states that allow psychologists to prescribe. It is not, so my state is not one of them. So there are some states that psychologists can prescribe. In most states, to my knowledge, only psychiatrists and medical doctors can prescribe. So, what is a psychiatrist or a psychiatric nurse practitioner or the medical doctor that prescribes psychotropic medication? So, all doctors have a pharmacology, have a psychopharm, have a behavioral health, mental health rotation that they do. I think it's at least a year. I'm not sure. Not a medical doctor. I have worked with interns and residents and fellows. So fellows are people that were medical doctors, but now they were working to become psychiatrists because a psychiatrist does regular doctor training for all but like 1 year. So they do 1 year specifically about psychiatry, but they do the surgery rotation, they do all of the things to be a full-fledged medical doctor because they are a medical doctor, and then they do a fellowship like additional training in psychiatry. And if my child is struggling with major intense they're have a lot going on emotionally, sometimes going to a psychiatrist or a psychiatric nurse practitioner, somebody that specializes in psychotropic medication, that can be really helpful. If my child has ADHD, I can talk with with my primary care doctor, the pediatrician, like I can talk with them about that normally. And this is not medical advice. This is just general tips, general education about what can happen and the different tools and resources that are available. And with the psychiatric medication, I like I like the psychiatric nurse practitioners. Sometimes this has been my experience. There's some psychiatrists that don't have great bedside manner. There's some that are awesome. So I follow some psychiatrists over on TikTok and YouTube that are very personable. They also have ADHD, but like they're awesome. I would love to work with them. But I've had some other experiences where with psychiatrists that had horrible bedside manner, did not really listen to the client, but they got the meds right. And so the client stayed with them because it was like, "Hey, they take care of my meds. It is what it is," but their expectations were kind of low. That is not everyone's experience, but I like to give that heads up that normally a psychiatric appointment is going to be that first appointment's going to be your history. They're going to come to a diagnosis and they're going to have certain recommendations about different options. If a person wants to talk about non medical, so if they want to talk about what natural options, what supplements, what options with diet, talking about that with your medical doctor, do they have any recommendations for supplements for any of those things? Talking about that with your doctor can be helpful. When we talk about levels of care, so for I'm just checking on my next situation to see what's going on, just to make sure. Um, so for levels of care, we have outpatient therapy, and that is the lowest level of care. And that would be meeting with somebody once a week. Sometimes if things are intense, it might be 2 times a week, it might be every other week. For most of my clients, when we start out, we're meeting at least every other week, because once a month is more of a check-in. Like, it's not like things are okay, like, we might even be working towards discharge if we're only meeting once a month. Um, just checking in on this one to see if I need to get alright. And then above that, in my state, we have intensive community based therapy. And that's where we have intensive home based therapy. That's between 5 to 10 hours a week. There is intensive crisis stabilization. In my state, Virginia, Anthem commercial insurance for some plans they offer this type of therapy if a child is at risk of an out of home placement. And but those are things that you discuss with your insurance company. For In Virginia, in my state, often the child gets the services that they can afford, not necessarily the services they need. And that breaks my heart because there are some people that would really benefit from intensive services, but financially, it's just like their insurance doesn't offer it, it's not available, and they're not able to necessarily get that. But they might be able to do uh, intensive outpatient is sometimes an option where a person goes to a psychiatric facility just for the day, or intensive day treatment. I know that's a thing as well. But it can be really, really hard to get good mental health care. It really, really can. And that's why I like doing these educational videos and talking about these things just to help people navigate what different things are available. Often, intensive community based services are meant to avoid those higher levels of care if we can. Um, so acute psychiatric hospitalization is if my child is in crisis. My child has made some type of attempt with themselves, somebody else. My child is actively hallucinating. They are an immediate risk to themselves or somebody else. In Virginia, you head to your local emergency room. There there are some insurance plans where you can head directly to a psychiatric hospital, but in my state, finding available beds is a problem, where sometimes a person in Richmond, Virginia, the closest bed might be 3, 4 hours away. And if that but then so what happens is they transport the individual in an ambulance 3 to 4 hours away, and that or sometimes I've also had situations where a person stayed in the emergency room for 2, 3 days, and they were never able to find a bed, and eventually they just said, "You have to go home and come back if they are still a risk." And so that's like a whole other soapbox and issue. And so that's where I really, really just want, because a family in crisis, one of the worst things you can do is to then have to, like, you came to get help and you're leaving, and your child just sat in the emergency room for 2 days and did not receive therapy. But that's where, as an outpatient therapist, my clients, they can call or text me, and we can move up, because let's say they were discharged on Sunday from the ER, and if I have appointments on Monday, we can schedule to meet on Monday. And if I meet with that child on Monday and they're still a risk, they're gonna go back. They're gonna have to go back to the ER. If there are those intensive community-based services, or if there are other things available, then we can navigate those things as well. And so this will have to be a whole other video because I think that is definitely real, and so that will have to be an entirely different video. Here, what type of therapy is more suitable for a child 6 to 7? And so that really depends on your child. There's some kids that I've worked with at 6 or 7, and family therapy was what we needed to do. And because it was giving the parent tools. It let me see, because sometimes the 6-year-old was fine with me, but when the family was there, it was a whole different kid. And so we needed, like, working with me one on one wouldn't have helped, because but, like, everybody together, okay, I got to see the dynamics. Play therapy is less talk based, and so if my child has difficulty putting their emotions into words, if they have difficulty with some of those things, then sometimes play therapy can be more helpful. I would want to make sure, because I think 6 to 7, involving the parents and the family is incredibly important. And some therapists don't do that, because sometimes it's just like, it's easier to work with a kid one on one, but to me some of the best work happens when you work with the child, when we work all together. Um uh and so, all right, let's all right. And so for resources, I listed some of my favorite books. One of my favorite books is Anxious Kids, Anxious Parents by Lynn Lyons and Reed Wilson. Of course, I had to throw my book in there. Uh, Turning Crisis in, no, this is not a parenting book. I'm working on my parenting book now. I'm gonna have to work on it. So the parenting book will be coming out. This is more for adults. I wrote this in the midst of 2020 into 2021, and in the midst of crisis, we can either have chaos or we can find clarity. And this has tips and tools for navigating this. Um, and yes, let me see what they said. Doo, doo, doo. Okay. All right. And so here are those different tools and resources. I also have an Amazon list that I have linked in the description with some of my favorite parenting books and recommendations. Let me just share this tab. Share this tab. All right. And so let's talk about body boundaries, consent, and respect. I absolutely love this book. Uh, and the Little Spot series, sometimes you can find these on YouTube where people read those books. If it's a young child, I like the book. I just don't like the sound of no because it talks about the steps for accepting no as an answer. Like it breaks it down. These are the steps for accepting no as an answer. And y'all know I work with adoptive families, and so I have books for adoptive families. Taking Charge of ADHD by Dr. Russell Barkley, that's one of my favorites. And but this has a ton of tools and resources here. Yes, I know your focus is children, but would you for an adult who's, so that's where, if you go back on this list, if you click on Dr. Barry's favorite things, I have self-help books, and I might have to break this down to just trauma. So I have a bunch of trauma books and resources. I also have done some past books on healing trauma and those things as well. All right. And if y'all have any questions or things that y'all would like for me to cover in future videos, please let me know. And I'm super, super grateful and thankful for you all. And I will see y'all next time. Have a good one. Bye.